today. I am so pleased to speak with all of you as we go into looking at some unbiased material. We were just talking about, Steve and I were talking about how you must be inundated these days with the information that you're receiving from all the companies. It can be so confusing, especially when you hear all of the advertising that's on TV. And clients call me and they say, Diane, why do we see so much advertising? What's that all about? And those are the kinds of questions that I've asked along the way within my journey as a career broker and becoming that. I first started off as an agent, and then I knew that I needed to add brokering to that so that I could have, as I was describing to Steve moments ago, people say, I'll say, I don't have a dog in the fight, but my friends and clients have reminded me that, yes, you do, Diane. And your clients are your dog. I don't know how I feel about that statement, but it's true. I do advocate for my clients much more than just the process that they start choosing their Medicare, but I also help with the service of all of those policies and knowing what to do when. Oftentimes, I find myself working with the different generations of my policy holders, and I'm pleased and proud to say that one family, I have 5 generations of policy holders right now, and another family with 4 generations. So my client span does go from 0 all the way to 103 is my oldest client, or my youngest client, as she likes to be known as. And she does carry that well, but that happens to be that family of 5 generations. So let's look at some of the questions that most people have this time of year, and that is reviewing their Medicare and saying, okay, Diane, tell me again why I have what I have. Or they could be one of the 65-year-olds where there's 10,000 a day that are turning 65 in our country and joining the ranks of those who are on Medicare, which there are 66 million people on Medicare right now, and 44 million happen to be on the original Medicare side, and 22 million happen to be on the Medicare Advantage side. And we'll discuss why. So at the end of the day today, we will look at that. So let's look at slide 1. And thank goodness for Judy. So she's going to bring that up. My phone number, you have my cell phone right there. So if you have a pen and a piece of paper, please write that down on top. All you'll need throughout this entire conversation is a pen and a piece of paper, and I will be showing you what to write on that. So you can just have that compilation of the notes. And then if you'd like to have a copy of this particular PowerPoint, I am so happy to send it to you. So again, my cell phone, easiest way to reach me during open enrollment or anytime is that 314-302, which is my birthday, 5743. So let's go on to the next slide. So you'll see here that today in lesson 1, and it's broken up into 2 parts, lesson 1, lesson 2, and we'll take about an hour. And during the whole course of this, you can put in the chat if you have a question, or if you just want to do one of these, that's okay too. That works for me, and Judy will be able to see you. So we're going to answer, what is Medicare? What agencies are responsible for Medicare? What are the 4 parts of Medicare? And then what's covered in the cost of Part A? What's covered in the cost of Part B, as well as how and when can you enroll in Medicare? Even if you're already in Medicare, you might want to know, can I change? When can I change? And we're going to discuss that. Let's go to the next slide. So the materials that I'm using, this is the source book. It's the Medicare and You 2021 book. Every year, Medicare, CMS, the Centers of Medicare and Medicaid Services, they will put out a new book. And it is digital and it's available. So right now you have my phone number. You can text me, yes, and I will know you would like a copy of this Medicare and You book, and I can get it to you. So again, I don't want to bother you with anything. My goal is to save you time, to save you money, and then to see if there's any solutions out there for you that do not change your lifestyle to choose those solutions. They would actually better your lifestyle and better your situation. But again, all of this is unbiased because this information is all coming from Medicare and You and has been approved by CMS to bring to you. So health insurance for people 65 and older, that's Medicare. Anyone who has ALS, they can get Medicare. And anyone with end-stage renal disease, they can also get Medicare. And those that have been on disability for 2 years, they typically can qualify for Medicare and Do. So let's go on to the next slide. So you'll see here what agencies are responsible for Medicare. As I said, on the right of the screen, you see CMS. That's the Centers of Medicare Services. They also are over what some would call Obamacare or the ACA, the Affordable Care Act, or it could even be called healthcare.gov or the Marketplace. 4 different names for the same thing. And that's the other side of CMS. But Medicare and Medicaid services are also part of CMS. And then also what other agencies do handle this. You can see the Social Security Administration and also the Railroad Retirement. You can also see that Social Security plays a role because that's where you typically are contacting them to enroll. We'll talk about when you would want to contact them to enroll in the different parts of Medicare. So let's go on to the next slide. What are the 4 parts of Medicare? This is the most important slide of this. It's actually page 6 of the Medicare and You book. And when I send that to you, I also send that page 6 so you can see this side that we're looking at. Then we're looking at the 4 parts of Medicare. So if you have a piece of paper, what you're going to do is you're going to fold it vertically like a hot dog, not a hamburger. And I tell my clients to do this, just fold it down vertically like this. So if you don't have a piece of paper, just grab one. It could even be a little sticky note like this. It doesn't have to be, this size, but this just helps you to take notes. And then you open it up and voila, you've got your 2 sides. And we're going to talk about original Medicare for a very long time. And then the last 2 slides of this presentation are going to be the Medicare Advantage. Judy, did someone have a question? No. Okay. So what you want to put over here on this side is, so yours is going to look kind of like this, and we're going to be going through this. If you can see this, it'll say original Medicare right here. And then on this side, you're going to put the side that says Advantage. So let's talk about the parts. Parts A, B. So original Medicare, which was this side of the page, if you did do that fold, original side is going to have parts A and B. A is your hospital insurance typically. B, you'll see the stethoscope. And so, of course, that's your medical insurance. And typically B is going to cover 80 to 20%, 80%, leaving you with 20% if you don't have any other Medicare with that. And then you see Medicare Advantage. And then you see the Part D drug plan. So they did it linearly. But I'm doing it side by side because it's actually easier to take the notes. So this side, again, is going to be your original Medicare. This side on your page is going to be the Medicare Advantage. So let's go on to the next slide. So Part A, these are the notes to take here. Your A, a lot of people will say this to you, that A is automatic. When you go on to Medicare, you're automatically going to be enrolled. Not necessarily true. You do have to work the 44 quarters in order to qualify for A. So it's not automatic. Sometimes you have to claim it, and sometimes you don't. It'll just come to you. So the best thing to do is to call Social Security and ask them, am I eligible for A? Of course, they're going to want to know your Social Security number, your birthday. They're going to verify you and that kind of thing, because they certainly don't want to give that information out to anyone but you. So your A is your hospital insurance. It's going to cover an inpatient hospital stay and inpatient skilled nursing care. This is very important to pay attention to. Because if you choose original Medicare and you are inpatient or you think you're inpatient, you need to know when you're in the hospital that you are indeed in an inpatient stay. Well, why would that be? The reason is when you go into the hospital, the way the law works, the discharge nurse in the hospital don't need to inform you that you are an inpatient until you leave the hospital. So you need to be in there for a 3-day inpatient stay in order for you to go to rehab. So if you have original Medicare and you're on the original Medicare side, you need to find out that you're inpatient. Now, if you have a triplicate of diagnoses, for example, my mom, she had an ileostomy. She also had 3 days of dialysis, and she also was contending with breast cancer towards the end of her life. My goodness, she had so much going on. So when she started having heart problems, they really didn't know what the reason was. So they put her under observation, and she was in the hospital. She thought she was inpatient. Well, we found out that when you leave the hospital and you are under observation, that goes under Part B of Medicare. So you want to be an inpatient, Part A, paying for your Medicare. So when you transfer to rehab, you will be paid. Now, some of the insurance companies have gotten pretty smart about this. So they have other hospitalization policies that you can look into. And if you would like that information, just text me yes and say hospital, and I'll know to send you that information. All right, next slide. So it says original Medicare. What does it cover? This is important. It covers blood, it covers hospice, it covers home health care. And people think, oh, it covers home health care. Wonderful. Well, it'll cover up to what Medicare will approve. And since there was the Affordable Care Act and the creation of healthcare.gov for the under 65, the amount of home health care provided for those that have the Medicare has diminished significantly, to the point in St. Louis, you typically see one RN visit for a medication setup. And then you also would see 2 visits by a physical therapist, and they might last for about 28 minutes. And then it's up to you. So Medicare Part A doesn't cover everything it used to cover before 2013. So if you need to know that information, text yes and put HHC for home health care, or you can write out home health care, and I'll make sure you've got that information too. So hospice care, we'll talk a little bit more about that too, because there is a distinction between home health care and hospice care. So Judy, I'm going to count on you that if I don't cover that, you bring that up at the end. All right? All right.
Are we on the right slide?
Yep, the next one. So what you would pay for Part A in 2021. The premium, there is no premium for most people. Unless, of course, you're like one of my clients that didn't work the 44 quarters, and I think he ended up paying this year $480 for Part A. So it's really structured for those people that did work the 44 quarters. And then there's a deductible when you're in the hospital. And then you have an out-of-pocket maximum, no greater than original Medicare. So the next slide, we have skilled nursing.
Oh, sorry.
So skilled nursing facility. This is covered in A, and it says original Medicare and Medicare Advantage plans offer short-term rehabilitation services in a skilled nursing facility. Custodial care is not covered. Oh my goodness. Well, custodial care is the stuff we like. This is what someone would follow our footprint in our home and provide for us. But that you would have to get outside of Medicare. Medicare does not cover that. And also, it's a matter of, again, in order to get into that skilled nursing facility for rehab, you have got to have that inpatient hospital stay. If you were observation, you would not get that unless, of course, you had an additional outside of Medicare policy. Okay, next slide. Home health care. Again, home health care is required for part-time and intermittent skilled services, and certain rules apply. Purely custodial care is not covered. So if you need help with bathing and dressing, toileting and transferring, incontinence and eating, you can see that you might be in certain areas of your home, in your bedroom, in your bathroom, and also in your kitchen area. And that's the custodial person you need to help with bathing, to help with washing, to help with all of the dishes, to help with the preparation of meals. And they don't provide that. Medicare does not provide custodial care. So again, if you're concerned about that, as my family has been in the past, they wanted to know what else could be offered to fill that gap. So if you want that information, just text yes and HHC. And then we have hospice care, and that's available for the terminally ill patients. And the focus is on comfort and pain. So here's the difference. Home health care, you have to be homebound to receive it. You can't leave your home for any reason. You have to show that you're going to meet those measure markers and you're going to improve by having some physical care at home or occupational care at home. Hospice is completely different. The way that hospice works is you have a hospice hospitalist and you also have your doctor. And if those two people agree that you could have the propensity to pass and to go into the next world in the next 6 months, then you can qualify most likely, most often for hospice. Now, no one knows when someone's going to pass. It's just the propensity is there. And then with hospice, you do get sometimes the bath aids. You do get more counseling and services and spiritual services that are covered in hospice. So it definitely is more robust. So in order to popularize that in the last couple of years, what you've seen is they call it palliative care. You've probably heard of that term. So palliative care is hospice, but it's a nice way of saying you don't know when your propensity is that you're going to pass, but it's a way for you to get those services without having to tell someone that someone believes that you are going to pass. So if you ever have questions about that, and you have more right now, text me and at 302-5743 and say yes and write hospice, and I'll get you that information. The next thing that you'll see, let's talk about Part B. So let's go back to our hot dog page here. So we've got our side by side, and over here we just talked about A lot. So most of you are not paying for A. So if you write A on your piece of paper, you could put 0 for the amount that it costs. And then B is you're deciding to sign up for B. And B is the one that covers, that's the stethoscope again, all the other medical services. And B is your doctors and what they do for you. And we'll get into all of these things on this list in a minute. But under B, what you want to do is you want to say, that's the one you sign up for with Social Security. And that's the one that's based on your income. And it's not your income currently, it's your income from 2 years ago. So you do need to kind of talk to your financial planner or someone who is working with you on that in your life and make sure that you're not going to come into a windfall and change what you're paying for B, because the bottom level for B this next year, what we're seeing is the Part B premium for those couples that make less than $172,000 2 years ago. So in 2019, that's going to be $153.50. So it's up 6% from where it was last year. Last year, Part B, the bottom level was $144. And so you're looking at, actually it's $144.60. And it went up 6%. Now your Social Security is only going up 1.5%. So it really is going up more than 4% altogether this next year. Now, if you were a single person and you made less than 82,000 2 years ago and you file single, then you're also in that category. But it goes up from there. And if you're concerned about B and what you would be paying for B, just again, text yes to me and say B. And I'll make sure that you get the chart. You know exactly what the chart looks like for you. All right. So what does B cover? Clinical lab tests, durable medical equipment, and also diabetic testing supplies, preventative services, and also the same home health care as A. So we are going to go to the next slide. So B, like I said, in 2020, it had that $144.60 premium, and it had a yearly deductible of $183. And then we're looking at the co-insurance that you would have too if you only had B. So I'm going to give you an example. Client calls me and she says, Diane, I am in the hospital and I think I'm going to have 3 stents put in my heart. I was like, oh my gosh, that's horrible. She said, what's horrible is the cost is $452,000 in the St. Louis area. Did you know that? I said, I do now. And she said, what's my cost? And I said, well, you have B. And she said, yeah. She said, what's that going to be? I said, I'll bring it down because they'll give it a Medicare code, and then they can only charge you what B would charge you. And she said, okay. And she said, call me. And I said, call me back. She called back, and it was 120,000 was the cost running it through B. If she would have only had B, then she would have been subject to that 20%. She would have had to pay $24,000. But as we travel through here and you go down the row of all of these, this side of original Medicare, you'll see that she had added a supplement. And so she only had to pay what her premium was. That was it. And she had to pay $183. It was amazing. So I'll tell you more about how that works. Next slide. So some people will call me and they'll say, Diane, I'm paying more for B than you said. Well, sometimes depending upon when you signed up for B, you might have a penalty. So we work through that and troubleshoot that and see that everybody has the right information to see if you did ever have credible coverage. But sometimes there is a late enrollment penalty, and it can be 10% for each full 12-month period that you didn't have Part B because you didn't sign up for it. Now, there's exceptions that if someone didn't tell you, your employer didn't inform you, that kind of thing, you can appeal it. And I help with those kinds of things too, of course. So my rule is if I'd help my own family, I'm going to help you too. So the next one, you see, when you have how and when you can enroll in Medicare, this is what you need to have in order to get Medicare. You need to have a Social Security card. A lot of people don't remember where they put it. So you've got to call and get a Social Security card or a copy of it so that you know you need to be 65, or there's other exceptions like the end-stage renal, or you might have coverage from your employer that satisfied credible coverage, and you just want to consider private individual Medicare as opposed to your group insurance. And when that does come along, we really take a good look and see if that's accurate and that's the best thing for you to do. Sometimes it makes sense to keep the group insurance. Sometimes it doesn't. But I will tell you and show you and explain it all to you so that you're not giving up something that later you wish you would not have done. So I'm very careful when it comes to that group insurance, switching over it to the individual Medicare. Okay, next. So when can you enroll? So we have the IEP, and we have AEP. Right now it's AEP. It's the annual enrollment period that happens when you have a Part D for the drug plan, or you have an MAPD. So an MAPD is a Medicare Advantage with a Part D drug plan. So we are now in the midst of that AEP that goes from October 15th to December 15th. Now, when is the IEP? The IEP, when you first get Medicare, it's your initial enrollment period. You're turning 65. Oh, wow. You're inundated with information. So you have the 3 months before the first month of your birthday month. So the first of your birthday month actually becomes when your Medicare can go into effect when you're turning 65. And then 3 months after that, it's a delayed time that you can enroll. And during the IEP, you can join Part A, Part B, Part C, which is also known as Medicare Advantage, if you also have A and B. And you can also get Part D if you have A or you have B. And you can also get your Medigap policy, which is the supplement. So it's like, okay, that alphabet soup, where does it all go? This is the original Medicare. This is your Advantage side. So you have A over here, you have B over here, you have separate D over here. Same thing over here. You carry over the A if you want the Advantage, you carry over the B, and then you sometimes, most likely in St. Louis area, you have the D included. And we'll talk more about that in a minute. Okay, so I'm going to pause here for a second before we go on to lesson 2. And I'm going to see what questions there might be right now. Judy, do we have anybody waving their hand at us?
We can, and there's no one in the chat box. So does anyone have any questions? I can unmute you, or you can unmute yourself and ask. I'm not seeing any questions at this time.
Okay, I'll go on. If you have one, just stop me, because I've been told that I can go up to gusts of 92 miles an hour. So I'll watch those gusts, my friends. All right, so the next one. This is the lesson 2, subject matters to be discussed. Original Medicare, parts A and B, and also Medicare Advantage, part C. The medical supplement insurance, which is Medigap coverage, and the Medicare prescription drug, which is part D, and what other concerns that people with Medicare should be aware of. Okay, so let's look at this. Basically, this chart right here, this next chart that you see, is what I have drawn on this piece of paper. So this is really the only chart you need to look at. The first one we looked at, it was linear, but this side-by-side one really does help, because what you're seeing is on that side where it says option 1, original Medicare, this includes A and B. So you have your original Medicare, A for hospitals, B for doctors. B is the one that covers 80%, leaving you with 20%. And then you get a D plan. And your D plan is for drugs and a drug plan. People ask me, Diane, how often should I look at that drug plan and see what is available? Well, right now this year, there's 27 Part D drug plans just in the St. Louis County area. So if you haven't looked at your drug plan in a while, it might be time to just dust it off. It's really not as big of an ordeal as people think. Sometimes I'll just say, just get your medications that you keep all, in a little jar, or in a box or whatnot, and then start telling me what you have, and they'll just let me know, and I'll plug it into the program. And there's lots of different formularies and programs out there and ways to compute all of this, but I just use the Medicare.gov program so that you're looking at what I'm looking at, and we can see the screen together, and you can see how it affects, when you put in your drugs, the different pharmacies that you might go to, as well as the overall cost. Some have an amount that you have to pay if you get into a tier 1, tier 2, tier 3 drug, mostly a tier 3 drug, where you would have to pay a deductible. Some don't even have a deductible, and some medication you might be on might not even be a cost for you, depending upon the plan that you're on. And then there's other ways to get expensive medications where you are not having to pay out of pocket, or you could pay out of pocket versus stay on the formulary, and that might benefit you financially. So we look at all of those strategies. So if that's a strategy that you're thinking, it's been a little while since I've dusted that Part D off. I know that I've had so and so for so long, but I wonder what it would be this year. This is the year to do it, because Big Pharma has been in the news about everything, and they're trying to be as transparent as possible with pricing and why they're priced that way and what other options you may have. So if that is your concern, you would text me and you would say yes, and you just put D right there, and I know exactly what information you would want to have. So you get a D plan, and then you also would get a Medigap plan. Well, it's also called Medicare Supplement. Why they do that? They call something with like several names. It's very confusing. So a Medicare Supplement is the one that takes care of that 20% and those other costs associated with A. So let's go back to my friend who called me, and she said, my client who said, they're going to charge me $452,000 for 3 stents in my heart. I said, run it through Part B. And she said, okay, now it's $120,000. And I said, okay. And if you didn't have anything but Part B, you'd have to pay $24,000. And she said, but I have a Medicare Supplement, Diane. I pay on it every month. And then all I have to do is pay $183 for a one-time deductible a year. I said, that's right. And she said, so will it pay the $24,000? I said, that's right. All but $183 of it, if you haven't already satisfied it. She said, oh my gosh, that's great. But you have to realize that with having that side, the bottom line, you got to draw a line down below where I have down here. And that line, it says down all the way down here, if you guys can see that, the extra costs on this side, dentist, the eye doctor, hearing, a gym membership, those are not included on this side. Those are all extra charges. Now, when you look at the option 2 side, where it says prescription drugs, where it says hospital and B and Medicare prescription drugs, all of that goes into a Medicare Advantage plan, and that's why they call it Part C for combination. But the difference is the Medicare Advantage plans have HMOs and PPOs, and they are governed, sponsored by the government, but they're provided by private companies. So they are able to give you memberships to dental and vision and hearing and gym memberships, and sometimes transportation, sometimes over-the-counter items, sometimes meals when you leave the hospital. So that's what you're hearing about, especially if you're hearing all the commercials this time of year. That's what they're talking about. So those are the 2 sides of Medicare that you get to choose from. You can't be on both sides, but you can choose from those. Okay, let's go on to the next slide. So A and B, so original Medicare, this is just a review. Because I've talked so much, I'm going to review some of the stuff. We have the original Medicare in Part A, and then we have B, and then we have your Medicare coverage, and you have your choice of doctors and hospitals and providers that are accepting new Medicare patients. And the costs are affected about whether or not they take the assignment. So when we talk about this side of Medicare, we really talk about this side as one where you can go anywhere in the nation that takes Medicare. So it gives you a lot of flexibility. The other thing is we call this side a pay ahead side. You know exactly what you're paying every single month. You can budget it. The other side, which is the Medicare Advantage, that's a pay-as-you-go side. And we'll talk more about that in a second. Okay, next slide. So we have the Medicare supplement insurance. Again, this is review. So we have your A, we have your B on the original side, we have your D, your drug plan, which you can get in and out of every year at this time of year during open enrollment and the annual open enrollment. And then you add your Medigap plan. And people always say to me, Diane, when can we change Medigap plans? Well, you can change it at any time, as long as you're healthy to do that. And you can pass all of the health questions. You can change into a different plan. However, in Missouri, thank goodness for those of us that live in Missouri, we are able right before the anniversary date. So it's usually 30 days before that anniversary date of your policy for Medigap, your Medicare supplement. We can shop the price and we can see if any other company has a lower price. So just did that last week for a client, and for 4 years we looked and didn't make sense to switch to another plan that was exactly the same plan that she had, just not the same price. And then the question comes, well, why aren't they the same price? If it's the original Medicare and if it's a Medigap plan, why isn't the same price, the same price, the same price? And I say, it's like car shopping. You go get the Cadillac and it's $54,000 on one lot, and you walk down the street and it's $65,000 on another lot. And you're going, what's the difference? It's the same exact car. Well, the difference is how much you're going to put into advertising and who you're paying and who's on your payroll and how much you owe on your building and all of that. So the same thing exists with these plans that are Medigap plans. If you have, for example, a Medigap Plan G, Plan G, Plan G, Plan G is all the same, but they're all going to be different priced. So Missouri recognizes that and says, right before your anniversary, the month before, you can change your plan. And if you find something that's a lower price, you can go into it without any health questions. All right. So the next slide that we're going to see, Medigap plans, basic benefits. So you can see Medicare Part B coinsurance and copayments, hospice care, and also Part A coinsurance and hospital costs up to 365 days. So, and then also the blood first 3 pints. So they all those Medigap and Medicare supplements, they all cover that. And the next one, you can see there's all different types of alphabet soup. So am I still on with you, Judy?
Yes. Yeah, I'm here.
Okay. And you still see me?
No, actually, you're not visible right now.
I've lost the sound.
Okay, hold
The
on.
sound is gone, 99% of it. I don't know what to do.
I think Diane's lost her internet connection. Let's give her just a minute.
Are you guys there? I'm sorry.
Yeah, we can hear you. There you are.
Okay.
We can see you
Great.
again.
I'm sorry. We just got a big boom here. We're getting the storm, the remnants of it from New Orleans. So it's coming our way.
Oh, okay.
I don't like it one bit. Okay, sorry about that. All right, so going back with this, so you can see on the Medigap plans, it looks like alphabet soup. So some of your friends might have had a Plan F for a long time, and Plan F was grandfathered in for all those that had it, and they could keep it, but those that are turning 65 can't get it anymore. So the one that is the fullest match to Medicare of covering that 20% and then some would be a Plan G. So to kind of give you an idea, in the state of Missouri, in the St. Louis County area, if you're female and you're turning 65, that ranges, starts at about $135 a month. So it's kind of nice to know that. And if you need to know what the range is for your age, then just text me yes and say age, and I'll know exactly what you're talking about. So you would text 314-302-5743, and you'd say yes, age, and I would send that right to you and let you know what different things have happened with all these different Medigap plans. So you can also contact your local state insurance assistance program and your state Department of Insurance too. They are very, very well versed with what's going on with what plans are available in our state. Thank goodness. Okay, next slide. So when you can buy a Medigap policy, now we talked about this, the best time to buy is when you have no pre-existing conditions. So, and then the other time is a guaranteed issue period. And so that's when you leave an employer, for example, you can go in and have no health questions. Companies must sell to you the policy they sell for the same price if you have a pre-existing conditions, and companies can't deny you during the open enrollment periods. So I'm often looking at those open enrollment periods for everyone, and also the different underwriting for the different companies. Depends on, if they have already a big book or they're expanding their book, they might have different stipulations for their underwriting, which they can. So that's an interesting, it's very interesting to know that happens. Not everybody talks about that piece as to why they might suggest to you, oh, try this company instead of that company. And it could be that they might find out that you have a pre-existing condition and they don't ask about it from one company to the next. Okay, the next one. So Medicare drug plan costs. What do you pay in 2021? So this is your Part D stuff. And just to let you know that Part D's this year in 2021, we're looking at Part D ranging from $7.20 all the way to $89.20 a month. So it depends on the company. And again, I was telling you that there's 27 companies in the St. Louis area that offer Part D. So it is important that we pay attention to it. Here's one of the things that is also important to pay attention to. If a friend says to you, well, I've always had my group plan and I really like my group plan, and they haven't ever had an individual original Medicare with a Medigap or a Medicare supplement, or they've never been on a Medicare Advantage. One of the things that I always look at with the group plans from the employer or the retiree plans is how much they're going to cost that particular client for their drug plan. Group plans typically have no stipulation when it comes to the pay the regular co-payment or co-insurance until your drug you have spent a certain amount of money. This next year for the drug donut hole, it's what you spend and it's what the drug company spends together. And that's the $4,130, and that gets you into the coverage gap. A lot of people call that the donut hole. So, and then you pay 25% more for the other drugs when you're in that hole. And to climb out, it's not what you spent. It's not what you spent with the insurance company. It is actually what you spent from the beginning of the year to equal $6,550. And again, I will say that group plans oftentimes don't have this stipulation. So if someone's on a lot of drugs and they come to me and they say, Diane, I want to switch. Well, the first thing we're going to do is look at the drugs, because it could really be a sad situation if they got into an individual plan and no one ever told them that their plan was unlimited. And it could be a possibility with group. It just isn't with any side when it comes to individual plans. So I hope that helps you guys, because I know all of you all talk to your friends about everything, just like I do. So if you hear group, then just say, we need to call Diane, we need to text her. And then I'll look at their group plan. I just looked at who was it yesterday? Carpenters. And then today I looked at pipe fitters. And then last week I looked at UAW, just to make sure that we were doing the right thing and not saying no to something that would cost down the road. So, okay, remember, you're my dog in the fight. So, Part D, cost considerations. Plans have formularies, list covered drugs. They're not all the same. They're really not. So when we put it in there, sometimes we'll find out that one company will cover the drug, the other one won't. One company will cover it if we appeal it. The other company will cover it if your doctor writes a note. And so I help you with all that maze too. So if you get on a really expensive drug, oh my goodness, please call me, because I've been able to make some friends in a lot of the different companies. And sometimes there's discounts, trials, and coupons that are available because it is law that every manufacturer has to offer. They have to offer a discount. The trouble is finding it. So I'm sitting there at NAHU's, the National Association of Health Underwriters meeting, and I'm thinking, well, okay, what's going to be my nugget today that I'm going to bring with me and I'll be able to help everybody? And that was the nugget. Big Pharma stood up there and said, there are discounts out there. You just have to know where to look. So I cornered that person and I said, where am I supposed to look? And I've got that whole list for you. So if you want that list, just text yes and put drugs. No, I'm kidding. Don't put that. The IRS won't like that, or anybody that would look at my phone. So just put yes and put D, and I'll get you all that stuff. I'm teasing. So, but I am serious. I will share with you what I've learned. Also, the late penalty for D, just like we talked about Part B, having a penalty where you might not have known that you needed to sign up when you were 65. And here you had this penalty, that 10% penalty. Well, look at that. There's another penalty. So if you get a Part D penalty, and are you on the slide 26? Are we on slide 20? I think it's the next one. Yeah, there we go. So if you are on the drug penalty, it is one that's going to cost you 1% of your base. If you don't like that, oh my gosh, and you're being charged that, let me know, because it just might be something that was in the paperwork when you turned 65 that they just didn't show that you had credible coverage with your employer, and it could be as simple as that. Okay, next one. Medicare Advantage plans, Part C. Now we come to the last two slides. Now we're going to talk about your sheet here. So on this side, with your original Medicare. So A, if you work the 44 quarters, it doesn't cost you anything, right? So you're not going to pay for A. It's going to be automatic. And then B, this next year, if you are in the first rung of 172,000 or less 2 years ago, or you're in the 82,000 file single, then you're paying $153.50 for Part B. So you want to put that there. D plans, if you're on original Medicare, it's going to range this next year between $720 and $89 in the St. Louis County area of St. Louis. And they all range with different amounts of deductibles and copays. And then the next one down here, Medicare supplement, you're going to put down here for a 65-year-old female non-smoker, it's going to start Plan G as in good. They'll start at right at $135 and range all the way up, depending upon the 26 companies that carry it. And then we also have extra benefits down here. Ta-da, ta-da, ta-da. And that's when you would add the dental and also the vision and the hearing and the gym membership. You would be paying for that yourself. Now we're going over to the other side, folks. We are leaping. We're leaping over. And that is your Medicare Advantage. It's all called Part C. And your A and your B and your D. And we're on number 26. Slide 26. So we have the A and the B and the D, and that A slides right on over. That B, you're still paying for your B. And then D, most of the plans in St. Louis have D in them. So you're not paying for D, you're just paying your copays when you go pick your medicine up or you get it mail order. And then you also have advantages in your Advantage plan. Well, what are those? That's what we're going to find out. And I'll tell you what, one of them is dental, vision, hearing, could be transportation, could be over-the-counter items like Pepto-Bismol or a blood pressure cuff. It could be a house call where they come to you. You might see a nurse practitioner at your home. It could be that you want to go to the gym. It could be that you want to go online and work out or get nutrition ideas. It could be that when you leave the hospital, you want to have 14 meals delivered to you. So that is what Medicare Advantage does, because the government is giving the private company money every month for your membership so that you can have enriched programs, and the concentration is on wellness. Now, here's the interesting fact. You need to know this. If you start out on this side and you are in Original Medicare, you have a one-time chance in your life to go over to this side and try it out for 11 months. If you don't like it within those 11 months, you get to go back to your original side. No questions asked. But I will say this, if you start over on this side, you're in Medicare Advantage side, and your health changes significantly, you would have to go through underwriting to get this side. And it could be very difficult or not possible. So that is something to consider when you're turning 65 or when you're first going on to Medicare. The other thing that's different on this side has fixed costs. Your original Medicare side has a fixed cost. Over here, this is a pay as you go. So up here you can see I put pay ahead. Over here I put pay as you go. These are my parents. Keep this in mind. My dad, complete engineer, aerospace engineering. He was in negotiations and contracts with the government. He loves this side. He wants to know exactly what, to the penny, what he's paying each month. That's more important to him than over here going, oh, I'll be healthy this year. So if I only use my plan and I go to see the doctor twice this year and I'm in an HMO or a PPO that has a zero copay and a zero premium, well, I just paid zero for my health care. That was my mom. So she was like, oh, just pay as I go. If I get a bill, I'll pay it. No big deal. But it's the styles. But now you know what kind of family I was raised in. I love my parents. So, but it was sometimes difficult. If I wanted one answer, you could count on dad for that. And mom was this side. So going on here, as we see, we'll just stay on this page. It says Medicare Advantage is sometimes called Part C, which is combination. It includes A, B, and D. It's offered by private insurance companies, which are approved by Medicare, and the types of plans vary. And there could be HMOs, there could be PPOs, there could be a PFFS, which is a preferred fee for service. We don't see that so often in the St. Louis area. Or it could be a special needs plan, someone who's on both Medicare and Medicaid. And I will say, if you are both on Medicare and Medicaid in our state, you have so many free benefits coming to you that is unbelievable when you find out that it doesn't cost you a thing, and the state is there and it's structured to make your life better. So the special needs plans for those that have both Medicare and Medicaid, oh my goodness, it's a wonderful service. Also, those who are veterans, there's plans just for you to thank you for your service. And those plans are wonderful. Sometimes they give you back money on your Part B. So less common plans can be an HMO POS, which is a preferred service. And if they take the plan, then you can go there. And then there also might be MSAs where you have a medical savings account, similar to an HSA structure, health savings account, where some people are very familiar with that with employers. But again, if there's one in particular you want to know about, just text me and say yes, and put the one that you want to know about. All right, the next slide, it says here, if you join an MA, are you still in Medicare with all rights and protections? Yes, you are. Do you still get the services covered by A and B? Yes, you do. The Medicare Advantage plan covers all those services instead. May you choose a plan that includes prescription drug coverage? Yes, you can choose a prescription drug coverage. May you have different benefits and cost sharing? Yes. And have a yearly limit on your out of pocket for medical services? Yes. And that's what we look at. So if I have a client that is on original Medicare and they say, Diane, I've listened to all these commercials. I think I want all this free stuff. I want to know more about it. I'll say, okay, we're going to find out exactly what you're spending, what your habits are like. And when you go see the doctor, if you've got a surgery coming up, what kind of dental work you're going to have done, all that stuff. Add all of it up with your premiums. And then we look at the other side and we see how much that year would have cost. And then we do a side-by-side comparison. Because again, I don't have a dog in the fight. You've got to know what it's going to benefit you and how it's going to benefit you. So the other thing, can you use a Medigap policy to supplement your coverage? Can you use a Medigap policy to supplement your coverage? No, Medigap is, it is a supplement, but you can't have Medigap and also Medicare Advantage. The two are separate. You got to pick your side. Original Medicare with a Medigap and a D, or all combined into one on the Advantage side with those advantages. Now, I just summarized this whole thing into 1 minute, and that is you're either on original Medicare with A, B, and D, D separate, and your supplement, and then you pay for your extras yourself, or you're on the other side, which is everything rolled into one. It can be in Missouri, and you're paying as you go, and you have all those extra benefits, and the other side you paying ahead. So now, before we close, I would love to know some aha moments. If you don't have questions, tell me something that you heard from me where you went, what did she just say? That's what I want to hear.
Steve, do you have, Steve?
Hi. It's very,
Hi,
very,
Steve.
very, hi, very, very nice lecture. It really was very comprehensive with a lot of material. One of the things that I found is I always had a Medigap G policy. And recently, a lot of the insurance companies I have found out want to get rid of the G policy. So they have raised, so even though my deductible is 183, even by taking the F policy, I save money even though I have to pay the $183. And I don't know if you've seen that or not, but I think a lot of the insurance companies want to phase out G. And so they're raising the premiums on G. And you can save a considerable amount of money by just going to an F.
Right.
The other thing on Medicare D, you have to look at a lot of them. Some of them have 0 deductibles, and other ones will have 365 deductibles. And it's a little difficult looking at them because it looks a little cheaper originally, but when you put in the deductible there, it gets a lot trickier. I've had some drugs that are actually generics, and you have to look at your tiers. They'll make a generic a tier 3 or a tier 4 for some reason.
Yes. Yes.
And you really have to be careful. You can call up and get that appealed, but you're taking a chance to make sure that they're going to do that when you go into a company. So you have to check all that out, because I've had a drug for 40 years that's a generic, and they have it as a tier 3, which is quite expensive. It can cost you as much as $1,000 a month or more.
Mm-hmm.
For a generic, and they get away with it, but you have to be careful when you're looking at you have to look at the tiers very closely.
Oh, absolutely. Thank you so much for sharing that. Yeah, it's amazing because sometimes, depending upon the zip code, you're right. The different plans that the original Medicare provides, there can be a huge difference in the amount of premium that you're paying, even looking at from one state to another. I have a lot of clients that are in Illinois also. Missouri's my home, but I also have these other states. I started adding them because that's where my family had spread out to. So if I went to visit them, then I could still kind of be working. on the visit. So in Illinois, over there, they actually can raise in Illinois the price for those supplements 3 times in a year, where you can only raise it once in Missouri. So I was looking at a price over there, gosh, I guess it was about a month ago, and I said, my goodness, this is low. And then he said, well, Diane, I want you to talk to my brother about this. And he had been through those 3 of those increases. So you're right. You have got to pay attention to that no matter where you live. Thank you so much for saying that. And then also, you're right again with the Part D. When you look at that and you really measure what you're spending on the deductible as well as the tier level and looking at also the generic, it can make a world of difference. And it also, you know, it's so strange. I had a friend of mine that went into a compound drug. And when she went to a compound pharmacy, that also, it was a little bit different than what she was originally prescribed, but it still worked for her. And she was able to save money that way. And then her husband was able to get a drug straight through the manufacturer and apply for a program through that. And sometimes that works too. So it's really a matter of troubleshooting all of that. And I blame it on my mom that I know that much about it, because she was always saying, Diane, this darn drug is too expensive. I said, well, let me see what I can find out. And then my dad would say, I hope you're sharing this with your clients. So I really appreciate what you're saying, Steve. Thank you so much.
The other
So
thing
true.
the other thing I'd like to ask is, if you go into an Advantage plan and say you need an operation, or God forbid you have cancer or some other thing that can run a lot of money, what is the difference? What have you found the difference in prices between an Advantage and traditional, if you get into you know, that you have to be a chronic, or you come down with a chronic illness? How much more can that Advantage plan cost you?
Well, it's interesting because you know, cancer, when I don't know, I kind of have a personal feeling about cancer that when it happens, you want to have the most options available to you. And one of the things that you do see on the original Medicare side, because it is Medicare driven, where you can go see a provider anywhere in the United States that takes Medicare, that really does increase your availability to be able to get in with a doctor that's right for your cancer journey. There are right now 2 Medicare Advantage plans that offer the nationwide, these are in our area, of course, in St. Louis. So my friends in Florida that are listening to this, eventually, you know, I'll talk about you later. But in St. Louis, for us on the call, there's 2 that have a nationwide network. So if you're in a large network that has over 1 million providers, well, then it does offer you that ability to go to whoever you would need to go to that would be more familiar with your cancer. For example, I had a client that called me and he said, Diane, I was going to go to a dermatologist here in St. Louis, and they were wanting to hospitalize me for 2 days. He had some lesions over his face due to sun exposure and skin cancer. And he said, but then I found another surgeon dermatologist down in Florida. And I said, okay. And he said, I was able to go to Florida. And it was an outpatient process there because he had performed like 1,000 of those procedures as opposed to 400 from the doctor in St. Louis. So this was pre-COVID. He got on the plane, he went down there, he had it done. And then he came back and he called me and I said, well, what do you think? He said, I think as long as someone has a national availability that they can make that decision for themselves, he said, it's empowering. He said, I think that health insurance is supposed to be empowering. So either side can work. It's just a matter of knowing exactly how it will work for you when it comes to cancer.
How much more can that be on the Advantage side? Can it cost
Well,
you more money?
No, and not necessarily, because the Advantage programs, the HMOs and the PPOs, the way that they work is they have a maximum out of pocket that you would pay. So in our area of St. Louis, you're looking at the maximum out of pockets for HMOs and PPOs. They typically range between $1,900 a year for all of your medical costs, excluding your drug
Drugs only froze.
cost, and they'll go up to 6 on the program that you choose. And typically what you see is that you're paying 20% for chemo and radiation across the board for the Medicare Advantage plans, and it's limited to that maximum out of pocket. So again, it's that pay as you go model that you would have. And so in order to see which one is better, it's a matter of looking at how much are you spending per month on your premiums on, and also your extra benefits that you're paying for outside of Medicare for original Medicare to be on this side, and then it's a matter of looking at what is that maximum out of pocket over here on the Medicare Advantage and comparing the two. And what's so interesting is everyone says to me, Diane, can't you do the same presentation for everyone? No, you can't, because everybody has a different price that they're paying. Everybody has a different plan that they're paying. And so for some, it works best to have the original Medicare. And for others, it works best to have the Medicare Advantage. And we would just look and see what is best for your situation. And sometimes there's ancillary insurance that you need to get and that you can get that makes your life better on both sides. For example, sometimes people have, what I cut my teeth on when I went into long-term care insurance, and some people have that. Some people don't know the gaps in those insurances, and they don't know that they should have short-term medical insurance from day one and not have an elimination period, which is the amount of time you have to pay for yourself. So it just depends on where they are in that journey and what other insurances they have too. And I just look at the whole picture and see what's going to work. And oftentimes the picture that I draw for my clients, it looks like, okay, pre-hospital, who covers that for home health care? Hospital, who covers that? Who covers the home care? Who covers the long-term care? And so it just has like these little, it almost looks like an octopus. So because in the middle it says continuum of care on my sheet, and then it has each one of those areas so that you know what piece of your insurance pays for what. And if you like that piece, and if you like the way it works for you, you don't make any changes. But if you want to change it, it's completely up to you after you've got the education that you need. So back to answering your question, it depends on the person. And it's always a matter of really doing a lot of listening to see what their goal is. Is it to save money, or is it to have more access to care, or is it to do both?
Thank you very much.
So you're welcome. Thanks for asking that. I didn't know I was going to get into those weeds, but I'm glad you asked it. What other aha moments?
We have two people. I know Norman had his hand up, and then Charlotte has a question that she put in the chat. Excuse me. She asked, are there differences between companies with regard to prompt payments?
Oh, absolutely. Especially during a pandemic. Oh my goodness, yes. There really is. Because some of the you look at the ebb and flow of customer service with all of the companies, and typically this time of year, they've trained some new people to be into customer service and to be into claims and to help out with the amount that comes in this time of year. Now, if you couple that with the pandemic going on and some being at home virtually and some working there still at the actual location, and then you look at some of them have been affected with the flooding, and some of them have been affected by the fires. in the West, depending upon where they are located, that everybody's pretty much even. We just smile and we do as much as we can. I do a lot more, oh my gosh, so much more customer service than I've ever done during the pandemic, to try and move things along and everything. But there's really not one over the other. With the side of the Medicare Advantage, there's a star rating that goes with all the companies, and they'll give that to you either on their website, or I can send you whichever star rating you would want to have, and it lets you know how their customer service was rated last year. But it'll be interesting to see the star ratings come out this next year. But we all are in this together, that's for sure. So I do a lot of everything I can do to help you get the claims done. I probably do more back office stuff than most brokers. And I have a great assistant for that. Edith Voiles walks on water. So she's great.
So we have a time for one more question. And Norman, I think you had your hand up.
No, I canceled my question. Thank you.
Okay, all right. Well, I think, Ronald, do you have your hand up? Wait, you need to unmute. You need to unmute. There we go.
Can you hear me now?
Yes.
TV, can you hear me?
Yes.
Yes.
Okay. I've seen TV commercials for zero copay plans. How does that work? Because I see a lot of specialists and I'm paying $35 a whack. Every time I see a specialist, I'm paying a $35 copay. And I've got a Medicare Advantage plan, a zero premium. But is there a zero premium and a zero copay, or it has to be one or the other?
So that's really referring to the dual plans that I was talking about before. Someone that has both Medicare and Medicaid. Those are zero. They zero themselves out if they're what they call a qualified Medicaid beneficiary. So, or a qualified Medicare beneficiary. So that's pretty awesome.
Okay. Thanks for the information. I have to
I'm
leave
trying
now.
to get back to you.
Yeah, you're kind of fading in and out now. I think the storm must be hitting you, Diane. And
I know it definitely is, but I'll tell you what, back to that question too, I would love to show you what is available this year, and give you a complimentary review, because reviewing doesn't cost you anything, which is important to know, but not reviewing could cost you an awful lot. So if you would like for me to contact you, just please text me right now, and then I'll have your phone number, and I'll send you a text back at 314.
Okay, first of all,
302.
I don't know how to text message. I get text messages. I don't know how to generate one on my own now.
well, we can share your information, Diane, and we can connect you to, Ronald, do you get email?
Yes.
Okay, so we can connect you through email.
Okay, great.
Okay.
Great. I look forward to it.
All right.
That's wonderful.
Thank
Thank
you.
you so much. And I just want to say thank you to everyone for participating today and your questions and your concerns, simply because I have clients that will send me information and say, Diane, I just read this article. You need to be aware of this. Or they'll say, Diane, I just got a bill. You need to be aware of this, that this is going on. So I do count on you guys to inform me so I can keep everyone else informed too. So I hope that I can add you to that informants of myself.
Thank you
Because
very
I
much.
know you'll let me know, Diane, you need to know this.
We will.
And I will appreciate it so much.
Thank you so much. It was very, very much information, and you just explained everything in great detail. And we'll have, this is a recorded program, so if anyone needs to see it again, you can see it again. You can contact Diane. We will share her contact information in an email with you, so that if you want to contact her directly, you can call her. So thank you, Diane.
Do you have an email address, Diane?
I do. I'm going to give you my personal email. It's Diane, DIANE, F as in Frank, 88, like 88 keys on a piano, at SBC, which is Southwestern Bell Charter, sbcglobal.net. So DIANEF88 at sbcglobal.net.
Thank you.
Thank you so much for participating. And to everyone again, I thank you so much. And if there's a way that I can help you save money, save time, or save you from frustration, you let me know. That's my job.
All right,
It's a pleasure.
thank you. Thank
All
you
right.
so
God
much.
bless you all.
You
Thank
too.
you. Bye-bye.
Bye.